Thank you very much. Thank you very much. It's so wonderful to be here. I'd like to do a big thank you to Salome and all of our wonderful sponsors and you, the audience here, to embark on this journey of education and change. I'm really excited about this panel today. I've got Dr. Chris Spooner here. Dr. Chris Spooner received his Bachelor of Science in Biology from the University of Victoria in 1991 and his ND from the Canadian College of Naturopathic Medicine in 1998. Dr. Spooner sits on the board of directors of the College of Naturopathic Physicians of BC and is adjunct facility at the University of British Columbia, Okanagan, and the Boucher Institute of Naturopathic Medicine in Vancouver. He's the owner of Paradigm Naturopathic Medicine and currently in private practice in Vernon, in Vernon, BC. And in 2013, Dr. Spooner accepted the position of postdoctoral fellow in the environmental medicine at Southwest College at Naturopathic Medicine Environmental Medicine Center of Excellence. Right? After completing the fellowship in 2005, he continued instructing at SCNM as an assistant professor, teaching courses in toxicology, environmental medicine, nutrition, and supervising student clinical rotations at Southwest Naturopathic Medical Center. While at SCNM, Dr. Spooner was instrumental in developing the Wellness Center in the Phoenix Fire Department Medical Center. So a warm welcome. Next, I have Dr. Doyle Weigel. I'm not a doctor. Oh, pardon me, nurse. Weigel. Thank you. Next, we have Paula Doyle Weigel. Dr. Paula Weigel is living her life on purpose every minute of every day. Paula has woke up to why she is here and her role in this lifetime. After being diagnosed with breast cancer in August 2012, Paula chose a path that would require research, determination, and surrender. She has done many modalities in order to support her body, mind, and soul while full healing. Paula's philosophy on health and healing any disease is to plunge deep into the dark, into yourself, in order to find the answers and the light. When the emotional and the spiritual heals, the physical will follow. If you are supposed to be here at this time, Paula's work now entails using her nursing, coaching, nutrition, and personal experience to assist others in healing themselves at a cellular level. Paula can be found working at the Medical Cannabis Clinic her and her husband opened in the city: spiritual life coaching, energy work, yoga, breath work, sound therapy, hanging out with her grandchildren, and traveling the world with her other. To contact Paula, you can do that through her website. Next, we have Dr. David Hepburn. Dave Hepburn is an award-winning syndicated columnist featured in several major newspapers across the United States and Canada, and is a recipient of the prestigious Canadian Newspaper Association Columnist of the Year Award. As a doctor in the military, he served on board a ship as a surgeon in the Persian Gulf War, and in 1995, he lived in the jungles of Vanuatu, where for 8 months he was the sole doctor and bush surgeon to 30,000 people. His book, The Doctor is in quotes, sane, was released in the spring of 2009. He was the co-host of the TV show Biologic on the Oprah Winfrey Network, and his interest in sports and sports medicine resulted in him being called to be a medical director in the 1994 Commonwealth Games and a team physician for Canada in 1996 Olympic Games in Atlanta. Dave has also been currently a team doctor to the national rugby teams, as well as a junior and professional hockey teams. He is on the board of directors of the David Foster Foundation and is a clinical instructor with the University of British Columbia Medical School. Amongst the growing number of media physicians educated around cannabinoid medicine, he is an active member of Society of the Cannabis Clinicians International Association for Cannabinoid Medicine, the IACM, and the Canadian Consortium for the Investigation of Cannabinoids, CCIC, and the Physicians for Medical Cannabis, PMC. Welcome. And last but definitely not least, I'm really excited to welcome back Corey Yelland. Corey used cannabis oil extract to cure herself of rare forms of cancer, and she was diagnosed in July of 2011 with anal cancer and was given 2 to 4 months to live if she did not do radiation. The doctor told her that she had a death wish and that she was going to die and walked out, so she made starting taking cannabis oil and waited a year to go back to the doctor and then was told she was cancer-free. Subsequent biopsies performed no trace of cancer. She said to herself that if this worked, she would spend the rest of her life telling people about this, which she now does. She receives thousands of emails and speaks with hundreds of people a week from around the world. She has played a small part in saving well over 1,000 lives worldwide, and those are just the ones she is aware of, as many people don't get back to her, and then she will hear through the grapevine that they are cancer-free. The youngest person that she has had the pleasure of seeing through cancer to cancer-free was 2 months old, and the eldest was 86. As well as continuing to do this work, 12 to 14 hours a day, 7 days a week, she does a podcast with her co-host, Ian Jessup, called the Cannabis Health Radio, 5 days a week, interviewing patients who have used cannabis to cure or assist in their various health conditions, as well as experts in the field. So please, a warm welcome to this amazing panel of experts. So we had a series of questions that we came up with before the panel, so that we would be quite concise. And the first one came from Dave in regards to how is this being accepted by the science and the medical community?
Well, first of all, I'm the one with the personality of a twig, just so you know. That's me. I'm a twig personality here. Because I'm a bit of an anachronistic sort of outlander, because I thought ayahuasca was a town in New Brunswick. And you know, as far as mushrooms, I order a few extras on my Papa Burger when I A&W. But when it comes to cannabis, this is a different ballgame. And yeah, certainly cannabis and cancer tends to really engender a lot of interesting miracle cures from the peels of some fruit that none of us have ever eaten, from some island in Micronesia that none of us have ever been to, and gets the tag miracle cure. So I think in the medical community, in the science community, that it really behooves us to bring in common sense in order to not sabotage the sort of promises, the potentials, the possibilities that exist with cannabis. We need to sort of stay away from extremes, one or the other. It's not the devil's elixir, and it's not a miracle cure that fixes everything. But it's somewhere in between that, for certain. And I think that when you're dealing with the scientific community, you're dealing with a lot of people who have ideas that are loosely formed and firmly held and fiercely defended. And as such, that stigma is a double stigma of cannabis and the stigma of a cure for cannabis. So these are issues that the medical community constantly will roll their eyes out. And I think it's important for us to realize that, you know, when the only tool you have is a hammer, everything looks like a nail, right? So we think it can cure this, it can cure that, and cure the other. And I think that in the case of people like ourselves, we need to use common sense to truly forward what is going to be a very promising adjunctive and individual therapy for cancer, which is so exciting to me. Anyways.
And how do you deal with the issues? I mean, I know personally when I tried to see my doctor for my license, I was told he couldn't deal with my case because it was against his insurance policy. And I had to then do my due diligence to find a doctor that he could refer me to. It seems it's interesting that some doctors are almost using the veil of an insurance as an excuse, potentially.
You know, I was last week I organized a conference in Saskatoon for specialists across Canada, and there was all across the country, and there is a tipping point. They, to an individual, said afterwards, "We are so glad that we learned more and that we are now applying it, particularly in the world of neurology." But also there were a lot of palliative care people there. There was also some pain specialists and rheumatologists. So there is a tipping point. And in a couple of weeks, I'm going to speak at the POOT, the Patients Out of Time conference in Berkeley, on the stigma that is faced by us in the medical community, how we overcome that. And so, yeah, when the physicians are being reticent, this because of really a couple of reasons. Number one, I hate to say this, but it's true. They're either too lazy or scared to find out more about it, or it's too easy for them to say, look, you know, go down the street to Joe's, cannabis clinic and get the information from there, because I don't want to really have to deal with it. So yeah, we have ideas that over the years have been really, unfortunately, deeply ingrained, and it's a very conservative, biased profession. So understanding that, I think you're going to get a lot further with physicians than any sort of extreme one or the other. That's my impression. I learned from patients, and I think as patients, you can teach physicians, because I'm humble enough to say that patients taught me how it works, because I was initially very conservative, which I'm not now. I'm just a twig.
Well, I have to say, with my doctor and with my GP, he didn't want to hear anything about it. He quite literally covered his ears and went, la, 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 la. Fast forward to when I'm clear, I had a 45-minute conversation with him. He's like, cannabinoids are amazing, Corey. Do you realize how many people we kill each day with pharmaceuticals? And he's done a 180. So sometimes it's just about seeing to believe.
Mm-hmm. The proof.
Well, it's interesting just because I get patients coming at it from the other end. So as a naturopathic physician, we'll get patients that are more inclined to move towards natural therapies in general, and they'll talk much more frequently and much more openly about cannabinoid use. And in fact, in any sort of situation with cancer, I mean, we're seeing that 70% of patients, and this is BC Cancer Agency stats, are using some form of natural supplementation in terms of their regimen. But I do find that there is a real resistance to even acknowledge that, and patients really get caught in either saying, well, I don't want to tell my doctor about this, in which case there are some significant issues that we really need to look at that. We need to be looking at drug interactions. We need to be looking at possible consequences of that. And so ultimately, at the end of the day, those doors need to open up so there can be a complete conversation that gives a person that whole comprehensive care and lets them explore all the options, whether that's chemotherapy, radiation, cannabis, vitamin C, you name it. And patients should feel that they are at the center of that process and that they are able to have those conversations without being judged or stigmatized.
So then to take it to the next question of how or in what aspects of cancer treatment does cannabis play a role? Who wants to tackle that one?
I can talk about that one. Sure. So again, I always be a little bit cognizant with it here, because naturopathic doctors in BC have prescriptive authority, but because we're not federally regulated, we can't prescribe cannabis yet. So with the coming legalization, we're not quite sure, but if it moves on to our provincial schedules, then that would be an option that may come available to us. So our college is very, very clear that we can't, tell people where to go to get this. That being said, I have all my patients that are coming to me have gone out and sourced it from somewhere. And I can tell you that, my practice in general, I have a very, very large integrative cancer care practice, and I would say at least 80% of those patients are all using cannabis. They're all using it. I recommend that they start looking at suppositories. Most of them have kind of made their way that way. We're trying to find sources that have consistently available forms of suppository, either as high CBD, high THC. I'm a very big fan of the terpene elements of it as well too. I think that there's some real benefit, just as Dr. Russo talked about this morning, and it just sort of brings into mind the whole synergy of it within the plant world of how these things start to work together in whole plant extracts and that. But the majority of our patients are using suppository, oral CBD. Smoking very, very few. Usually that's just for anxiety or pain.
Anyone else? No. So then if it is all about CBD, are there other compounds that may benefit?
Well, definitely I'll go with this one again then too. I think, the interesting thing is that when we take a look at other plants, like one of the challenges that we find with cannabis that gets raised fairly frequently is where does it fit into someone's overall care? And some patients are going to be looking at palliative, some people are going to be looking at pain, some people are looking at anti-tumor effects, this type of thing. So when we're taking a look at how does it fit into this and the other components of it, we want to factor in, are there interactions with, is the patient on chemotherapy? Are there metabolism issues? Maybe we start changing some of the way the liver clears some of these drugs out. So we have to be cognizant of that. And that research is just starting to come out. We're seeing more and more about it. But there's no doubt that the different agents do different things. I mean, there's literature, and when we take a look at what's going on with regards to active effects, all of this stuff is animal studies or test tube studies. I mean, we're seeing the only trial that we've seen in a human that I'm familiar with, and that doesn't necessarily mean that I know everything by any stretch, but we know was actually an intracranial application of THC in glioma patients, which showed some reduction in tumors, but you're not going to get the BC Cancer Agency cracking your skull and dripping THC on it. It's not going to happen, right? So when we're talking about what other compounds, how do we apply it, we have to be aware that the literature on this is it's evolving, and we're glad to see it. But things like limonene and the terpenes, we know DL-limonene, for example. This is something that we're seeing used in gastric and esophageal cancers. We use it a lot in acid reflux. This type of thing. We're seeing some of the things like THC are binding and showing some affinity for things like HER2 receptors. So something like Herceptin, which is a synthetic form, potentially there's applications in breast cancer. So you're seeing the different compounds coming in quite differently. When we approach cancer from a naturopathic approach, we're looking at sort of multiple pathways. This is a boxing match. We're trying to find different ways of approaching. Are we looking at blood vessel stop? Are we talking about inflammatory pathways? Dr. Bob and mitochondrial function and this type of thing, we're seeing some of these elements. So I think it's not all about CBD. It's not all about THC. You're looking at these other compounds, and you have to understand the nature of the tumor that you're dealing with, because everyone is different, and you may have an inflammatory issue. You may have an apoptotic pathway. You may have a mitochondrial issue. You might have a metastatic issue. And each one of those things you have to address and take a look at the toolbox that you have available to you.
And that was really well said. And that study he referred to, where they actually injected THC into the brain, right into the tumor, was in a very aggressive type of tumor known as GBM, glioblastoma multiforme, which I've had some personal experience with friends who've had it and friends' family, and it is a devastating, aggressive tumor. So they went right after the top, one of the most ferocious tumors that there is, and that was in 2004. And they did infuse in 9 patients. THC, 97.8% THC, by the way. That's a heck of a party. But anyways, so they infused that in. And while that was not, it was just a safety study, it wasn't really looking at efficacy. However, it has prompted subsequently another study involving GBM, this time with both CBD and THC. And this time I can tell you that the results of this study involving this very aggressive tumor were such that normally, in a case where you're just treated with chemotherapy, in this case temozolomide, 53% survive only 1 year. Only 53% survive 1 year. With the addition of a CBD THC, 83%. It was remarkable. And the average lifespan from the day of diagnosis of a recurrent GBM is normally 368 days, a year, 3 days. But with the addition of the combination cannabinoids, it was over, it was 570 days. So it doesn't seem like a lot, but we're grateful for small victories in this, and we have to watch as they come along. It's like saying, for the Americans here, the metaphor here is that, up here in Canada, we all use dog sleds. So we have, in fact, invented a way to make dog sleds go faster, and that is that we replace the 2 lead dogs with 2 cats. Which works fine until you come to the first tree. So I say that because this is how we have to approach this. Is yes, there's improvements along the way that we're going to make, but we do so in a manner that is, again, we have a host of preclinical studies. We have observational, we have tissue culture, we have experimental, we have animal studies, but until we also have the clinical studies, we have basically case histories, and thank goodness for Corey Yellen, who has a history of these case histories that we need to see more of. And so that's the current status of it, of where it is now. Again, there have been, just because of the regulations, just a paucity of true clinical studies that allow us to really say definitively that this is going to be a great treatment adjunct for this or for that.
I'm going to add one thing real quick. Green tea extract, epigallocatechin gallate, actually enhances the absorption of telazolomide into the affects tumor absorption as well too. There's some studies on that.
But does the dog sled go faster or not?
It was interesting because in our time of polling questions, both Corey and Paula both had interesting questions that were pertaining to the efficacy in regards to dosing and what would be the proper dosing. Can anybody want to speak to that? Microdosing versus regular dosing. When you're dealing with cancer, breast cancer, that's hormone driven, what's more effective, a THC versus a CBD? I mean, there's so many different studies, there's so much information. How do we cut through it all so we can be concise?
Well, I don't know how we cut through it all because hormone-driven breast cancer makes me nuts. When I first started doing this, we treated everything with THC, high THC. That was the way to go, make sure it's high THC. And when pertaining to breast cancers, when we had something like a triple negative, we were quite successful. And with the hormone ones, not as much, although we did have some victories. And then fast forward to CBD becoming the new kid on the block, and then the studies, and the study out of the University of San Francisco, or the San Francisco Hospital. Anyway, there's indication that in some cases, THC can actually push the cancer when it's hormone-driven. When I was in Prague, I had the privilege of meeting several doctors who are using cannabis oil with patients, and the general consensus now with hormone-driven cancer is 2 to 1 or 3 to 1 CBD to THC, with CBD being the bigger amount. But I think Paula's more of an expert on that because she's walking that road or walked it.
Yeah. So I can speak to my own journey. In August 2012, I was diagnosed with hormonal breast cancer. So I was 100% ER positive, estrogen positive, and then 99% progesterone positive, HER2 negative, which is a good thing. So I think it was probably in March 2013 when I found out about cannabis, and I started on cannabis oil. I ramped myself up to 1 gram a day, because back then that's what we were supposed to do, in 2.5 weeks. I remained on 1 gram to 1.5 grams because I thought, if I can get it in me, I'm going to get it in me. And I did that for 8 months, and my tumor grew. I'll go back a bit. In August, I refused chemo and radiation. I had a lumpectomy. I researched for 3 months, despite the oncologist telling me that I was going to die if I didn't do what they wanted me to do. I left the office, and I was more upset for the other patients that would follow me than myself, because my personality is one that don't tell me I can't do something, because I'll do the opposite. So I left his office and just started researching. I ended up going to Mexico in November for treatment. In March, I started Gerson therapy and the cannabis oil. And what it did for me, in my bio that she read, when I said that when you heal spiritually and emotionally, the physical will follow, that's what happened for me. For 8 months, I went through dark night of the soul. And it was horrible, horrible. My husband would leave for work in the morning, and I'd be sitting in front of the fireplace crying, and he'd come home at night, and I was doing the same thing. And all I can say is I felt like I was crying for humanity. It wasn't me. There wasn't anything that I felt that I had to do or purge, but obviously I was purging for humanity. So fast forward again, that lump grew because of the high THC. I ended up having bilateral mastectomy because I was losing use of my left arm. And then I didn't have cancer. I was cancer-free, no evidence of disease. And just recently, I kept having pleural effusions that came back non-malignant. Just recently in February, I ended up in the hospital. I nearly died again. I have died and come back. My journey is one that is a sacred illness. I don't believe that I got this to die. And I had emergency surgery. I had an empyema from a thoracentesis that I had that's draining the fluid from my lung. And the pathology came back that I had breast cancer cells in my pleural space. So that's where I am now. They said that they took the cancer, they got it all with surgery. I don't feel like I have cancer. I've never felt like I have cancer. So that's a bit about my story and what I'm doing now. My husband is an internist. I'm a critical care nurse. We opened a medical cannabis clinic in our community in Medicine Hat, and we have, I would say, 99% buy-in from the physicians. Maybe it's 100 now. Because of my story, I think, because of my husband working in the community, it's amazing. It's amazing the stories that we're hearing, the follow-ups when the patients are coming back. They're not using walkers anymore. It's amazing. This plant is so amazing. I owe my life to it.
I think she's amazing.
It's not even a little bit of it.
Do we have time for another question? Yeah. Thank you. So one of the questions that came up from Chris was, how does cannabis fit in with chemo, radiation, and surgery? And I'm curious if anybody would like to speak to that.
Chris, that was your question.
That's okay. I heard you were on the panel.
Well,
I figured I'd leave it to
Yeah,
you.
no, I just,
Yeah, it's a good.
it's MD at that side, MD at the other side here, so we're going to have a little battle in between here. But,
Exactly.
I think that, it's adjunctive therapy. It has been shown in some studies. I think you're probably thinking of the King, what's the hospital in London? King George. Anyways, the one that shows, St. George's, that shows that radiation therapy in conjunction with cannabis was so effective, it shrunk the tumors down to a tenth of their size. When you added, again, both of these, again, with some of the other sort of, the most resistant type of tumors are the ones that are resistant to some of the really powerful chemotherapies. And what's been interesting is that this is actually, in some cases, shown to potentiate the effect of other modalities. So it makes chemo more effective. It makes radiotherapy more effective in some cases. Again, as you heard, in some cases THC was very damaging. In other cases, this is why when people say, well, cannabis does this or cannabis does that, my first question is, well, which one are you talking about? Because there are so many. And so we have to obviously suss out and sort of determine which of these creates, is beneficial, so that we don't just suddenly say everybody take everything for everything. It's not going to help. And we need to sort of be more selective and determine, rather than aggravating breast cancers, and we need to sort of say, well, we need to know more about these sort of things. But yes, it does potentiate the effect in many different issues with other modalities. But Chris, that was your question.
Wow, we're not even going to fight that much.
You notice that we're sitting in between the two.
Yeah,
Just saying.
I feel like going and give him a big hug right now. I don't disagree. I think the same thing is that cannabis is a complex thing. And we see this with herbal medicines. One echinacea versus another. We're talking about how you grow the plant. You're talking about the conditions it's harvested under. You're talking about what part of the plant you're using. So all of these things are very, very different. And we have to recognize that there's these different elements to it. And they're going to have different impacts on your therapy. So for example, if we're talking about radiation therapy, with the biggest issue, I shouldn't say the biggest issue, but certainly a significant issue with radiation is the fact that you have hypoperfusion. You actually need oxygen and blood flow into a tumor to actually generate the free radicals within it that actually kills off the tumor with the radiation. And if you don't have adequate blood flow into this area, and there's a hyperperfusion element of it, you're not going to actually get the effect of killing. And for many of the larger tumors, the cell starts to die off in the middle, or it's underperfused because of that. So perhaps maybe there might be some role in understanding that. Perhaps there's a role in cannabis with regards to that element of it. Where I tend to use cannabis and radiation is post-radiation. We tend to use the salves. And what we see here is that a salve topically works fantastically well for preventing radiation burns. And the skin heals up remarkably well afterwards. From a chemotherapy standpoint, we're seeing some of these preliminary data that tells us that, yes, it is augmenting some effects. Interestingly enough, if you take a look at some of the ones that it augments, things like vincristine, paclitaxel, these are plant-derived chemotherapy agents. This is periwinkle and Pacific yew tree. And in fact, as herbal tinctures in that, some of my colleagues down in the States are using the whole plant extract as an adjunct within, they're finding reduced toxicity with some of these agents and actually using it in conjunction with the conventional approach to actually reduce some of the toxicity and the side effects. And I think this goes towards the whole synergism of the plant and partially replacing in some of these intangibles that are within the whole plant extracts versus a concentrate. But again, we do have to be aware that certain drugs are metabolized through our livers in different ways, and some of these cannabinoids will alter this. Especially if we're taking a look at things like antidepressant medications, cardiovascular drugs like calcium channel blockers, NSAIDs, acid blockers like proton pump inhibitors and things like that. These things are all going to affect the metabolism, and when you're throwing cannabis into this, if you don't know what the endocannabinoid profile is that you're actually dealing with here, you don't really know what it's going to be, and it's going to be a bit of a dog's breakfast out here, and you may get inhibition of these things. And the problem is when you shut these enzymes down is that you actually increase the level of the drug within your system and you don't clear it out so much. And so you can alter the dosing parameters on that. So when it comes down to chemotherapy, what I will often suggest to patients is like, look, let's just take a back seat on this one a little bit. If you're going to choose to do the chemotherapy, let's make sure that we're taking some time away from that over your course of your chemotherapy and try and structure your dosing on that and see if we can actually sort of, tag team that and be a little bit more judicious in it.
What do you do?
With patients that I've seen, and obviously I don't have the medical background, I'm more about being in the battlefield. Certainly people who choose to do chemo and do cannabis oil with it, the side effects, they come through it so much easier. Absolutely. That's my general observation. Absolutely. From children right up to the elderly. They breeze through it compared to the people who don't.
In fact, for cancer patients, the risk to die in hospital was reduced 56% for patients on cannabis. Wow. That was a study over several years involving 4 million patients out of 1,000 hospitals in the States. And you think of why. Why would they die at home as opposed to in hospice? Well, the reason people go to hospice is because of pain. It addresses that. Anxiety, insomnia, about fear. Which is a very real. This obviously the fear extinction response is huge, and just feeling better all around. So sometimes we don't even think of the palliative care benefits of it, but they are really beneficial. So 56% reduction in patients dying in hospitals if they were on cannabis. That to me speaks volumes.
And I'll just add an interesting thing, and Dave, maybe you can comment on this a bit, is about opioid growth factors and the potential, some of the preliminary data suggesting that perhaps maybe some of our opioid pain medications might actually fuel some tumor growth on that.
Yeah.
So the interesting thing, and again, preliminary data, so I'm not trying to say don't take your morphine. I think we need to be judicious about this as well too, but we need to recognize that some of our pain medications, if we can make a shift to either, using cannabis, or we can use modified reduced dosing schedules of morphine in conjunction with cannabis, are we looking at decreasing tumor progression? And I think that's a question that's I've seen a number of papers on this now, 3 or 4 of them, so it's not a huge amount, so let's put it in a proper context. But I have seen clinically that when patients come out afterwards and they're given high morphine levels, it's a concern for me, and we definitely try to be very aggressive and switch them over to a different type of pain control. And if they're using cannabis already and open to it, then we look at changing their dosing schedules to make sure that that's getting them what they need.
Yeah, I haven't seen those studies because I don't read the papers if they don't have pictures on them. So if they didn't, those are like good artists.
More cats.
But we know certainly there's definitely this sort of the mu receptors, the pain receptors, and the effects of opiates on them. I don't think we can get to the point yet where we say that opium causes cancer, but we can say that there are effects that we certainly don't know about. Again, I don't know enough about it, honestly, to comment intelligently on anything, actually, usually. But it is irrespective, I would suggest that, the proof is in the pudding. And when the patients are that degree happier, and I remember when I was first learning this 15 years ago, a friend of mine said to me, wouldn't it be better, even if it didn't fix it, isn't it just to be better to be sick with a smile, was his phrase. And I thought afterwards, that is not the worst side effect in life. And so that has sort of guided how I feel about using it in patients for whatever conditions. It's okay, we're all going to eventually succumb, but why not do it with a smile? That's my thought.
For my last questions, I'd love to bring it back to both Corey and to Paula from a user experience. Some of the questions you brought forth in regards to can you take your cannabis and still work, and how do you travel, I think are really poignant questions, and I would love to explore them a little.
Oh, you'll be okay. You'll be okay. Go for it, Paul.
Cavity's hidden somewhere.
Travel and work.
Traveling, yeah.
Traveling.
Traveling?
Traveling.
From Medicine Hat.
So legally or illegally? Because I can't really comment.
Still ask for cavity searches.
You can travel legally within Canada if you're licensed with your medicine, but you can't pass the borders. As far as working and using cannabis, I quit work to use. I couldn't have worked. But there are a few patients that I have with breast cancer that are doing a gram a day, and they're still working. And they're doing it suppository, so they say that they're not high, which is true. When I had doctor's appointments and stuff, that's how I would do it so that I could drive.
When I talk to like the young mums that have to be on their game in the daytime and stuff, or are working, what I suggest to people is they do it. I would say if you want to have a life, do suppositories in the daytime, because then you're not going to get high, and then at nighttime do it orally. Cover all your bases. Do it both ways. Mm-hmm. So then you're able to function. And then there's the whole thing, and it's relatively new, or new to my world anyway, of microdosing. So there's lots of people who, for whatever reasons, are really, really sensitive to the taking it orally, and for whatever reason maybe not able to take it rectally. And so if you start, instead of doing, let's just say they're trying to get up to a gram a day, because there's still people that are of that mind. If you're doing a dose, say every hour, just a little tiny pinhead amount, so that you're not totally inebriated, it definitely helps. But
She looked at me when she said pinhead. I'm not sure what you were thinking there. Look that way next time.
well, I know, some people are doing suppositories using capsules, and when I was in Michigan and first met Dr. Bob, he said they're only getting 70% absorption. So generally what I do is get people to get a 1 ml syringe and warm up a little bit of, olive oil, coconut oil, whatever, and mix the cannabis oil in, and then just insert it. But I have to share a quick little story here. So I got this call from this woman whose husband's got prostate cancer with Mets. And she phones me, and she's really upset. And she said, I don't know what to do. John's refusing to have any more suppositories. And I said, well, how many has he had? And she said 2. And I said, okay. And she's like, I told him he should just walk it off, and it's his life we're talking about. And I said, well, why doesn't he want to do suppositories anymore? And she said, well, he says it hurts too much. And I said, well, what size syringe are you using? Are you using like the little diabetic one? And she said, yeah. And it's hard enough trying to push that thing through the needle. I was like, so now I tell people,
No needle.
minus the needle.
Oh, wow.
So I think he was actually a really good sport, because he did it twice.
Oh, wow.
Like,
He must have wanted to live.
Ouch. We usually,
I got to sell for that.
I recommend the same type of dosing schedule: suppositories during the day, take the oils at night, dose up. I find that a number of patients actually start to accommodate to it. So after they've been on it for a period of time, they start to actually get a little bit more function with that.
Yeah.
Some of the things like the acetylcholine that you're talking about,
Yeah.
and maybe some of these terpene compounds might be helpful as well too. And that would be something to investigate.
Yeah, and black peppercorns.
Yeah, and the limonene is another one
Yeah.
that helps clear that. Yeah.
So I'd like to open up. I can take 2 questions from the audience, please. Hands up loud and proud. Yes, please. I'll repeat the question. Yeah.
CBD.
I had a woman in the UK whose mom was really badly off with Alzheimer's, and she was in a home and nonverbal, didn't feed herself, didn't recognize, Rona was the woman's name. And she put her on a combo of high THC cannabis oil and coconut oil. And I'm not sure the time period, but suffice it to say that her mother was able to come home and live with her and joined the equivalent of Silver Threads over there, able to dress herself, feed herself. I know, talking to Janet Sweeney of the Phoenix Tears Foundation about Alzheimer's just, I don't know, a few weeks ago now, she was saying high THC, small doses, and it makes quite a big difference.
And I'd also go to this point here real quick that some of the stuff that we're seeing about Alzheimer's is about, there's a treatment about a nasal infusion of insulin. And so the idea of Alzheimer's being a blood sugar dysregulation issue, blood sugar issues, mitochondrial function in the brain becomes really, really interesting. And again, when we're talking about energetics and shifting some of that stuff with cannabinoids, and there's, we see some of this with, I think, British Journal of Pharmacology had one on the entourage effect, or the dual effect of THC and CBD, where one actually caused a little bit of some damage, but the CBD actually helped enhance the recovery on that. So I think between the blood sugar issues, stabilization, and some of these other effects, I have seen patients that have benefited from it. And I'm not sure if it's more of just the calming effect, or if there's actually a cognitive thing there too. But
Such a fascinating question. Definitely fuel for a different panel for sure. One more question? Yes?
I've had a brain tumor and I've been on the oil, but for legal matters I had to stop taking the oil. And I've had my first scan since the oil and my brain tumor's grown a little bit. But where can one find oncologists that are on board or neurologists that are on board with cannabis treatments for legal matters, or just to get the whole thing ducks in a row?
Where's he from?
You specifically in British Columbia? Gee, you know what? I think it's we're still at that tipping point. Adam, right?
Yes.
Yeah, I remember you. Yeah, absolutely. We're still at that tipping point. So there is, it's again, I hate to say, there's a real reticence to say we're going to treat this with this. But that being said, there are neurosurgeons, for example. I know that we're speaking with Hutch about Dr. Brian Toyota here in Vancouver, who's doing a study involving. I think, isn't that right, Dave? Or I won't get into details. I mean, I would say keep your ear to the ground as to who is basically helping with respect to using cannabis in the cancer areas. So it could be the specific cancer specialist, for example, a neurologist, or it could be an oncologist who does all cancers. So you have to sort of find out which of that area. Neurologists are coming on board probably more quickly than any other specialty in Canada. So it's good to see, because they recognize that further question, the neurodegenerative conditions, I mean, that's a whole other discussion. And there are some fascinating things happening in dementias and other things like that. But that is a whole hour and 7 minutes. So it's a long one, yeah.
just an hour.
Yeah.
Okay.
So we've come to time. I would really love to thank the panel for your heartfelt thoughts and considerations and for the hope.